Welcome again to NCLEX Made Simple YouTube channel. Here we prepare content for you to help you in your NCLEX preparation. So if you are sitting for the NCLEX anytime soon, this is the place for you. Kindly subscribe to our YouTube channel so that you can get notification for every video we post on our channel page. So today we are going to talk about Lyme disease. You may have seen this Lyme disease in your questions as you prepare for the NCLEX, and perhaps you have never understood what it all entails. So I'm here to help you with that. So chill and let us learn together. So Lyme disease, from this diagram here, you can be able to see there are ticks there. At least you can have a general overview of what is happening, and someone has a rash. For the lovers of a game of darts, there's what we call the bull's eye. The bull's eye is what you can see at the center there. So that's Lyme disease. We can now end this presentation. Wait, there is more to that. So let's find out. What is Lyme disease? Lyme disease is caused by this bacteria known as Borrelia burgdorferi, and is transmitted to humans through the bite of an infected deer tick. There are some people who don't know what tick looks like. So when we are talking about this Lyme disease, that is a tick. Two ticks, they are down there on your slide. So Lyme disease can affect any part of the body, including the brain and the nervous system, the muscles, the joints, and the heart. How is it transmitted? Ticks are able to attach themselves to any part of the human body. They are most often found in hard-to-see areas, such as the groin, the armpit, and scalp. In most cases, the tick must be attached for 36 to 48 hours before the bacterium can be transmitted. If the tick is removed quickly, let's say within 24 hours, it greatly reduces the chances of getting Lyme disease. Prompt removal of the tick is important. That's very important. So let us now look at the pathophysiology of Lyme disease. These ticks are usually found in wooded and grassy areas, and once bitten by the tick and the disease has been transmitted, it progresses into 3 stages. We have the stage 1, which is localized, stage 2, early disseminated, and stage 3 is chronic persistent. Let us look at them one by one. So the localized, it begins 3 to 30 days after the bite, and that is where the patient will develop the bull's eye rash, which we normally call erythema migrans. The patient will also have pain and stiffness of the joints. And now this localized stage 1 can be treated with oral antibiotics. The antibiotics are normally used to treat this condition are doxycycline and amoxicillin. And for those patients who are allergic to penicillin, we use erythromycin. So the symptoms, if they are not treated, they will disappear within 4 to 5 weeks of no treatment. Early disseminated develops if the disease is not treated or if treatment is not successful. So if the disease is not treated successfully or does not respond well to the treatment, or it is not treated at all, it might complicate into early disseminated, and whereby the patient will experience dysarrhythmias, dyspnea, candidiasis, dizziness, meningitis, facial paralysis, and peripheral neuritis. Now at this stage, the treatment includes IV antibiotics. The antibiotics of choice here are ceftriaxone and cefotaxime. So it is important to note at that early disseminated stage, we use IV antibiotics. In a chronic persistent stage, this one occurs months to years after the tick bite, and this leads to chronic complications such as arthritis, chronic fatigue, memory, and thinking problems. These may not respond to treatment, and the client develops permanent damage to the joints and the nervous system. This condition called Lyme disease is sometimes referred to as the great imitator. This means it imitates symptoms of different diseases, and most of the patients may not be correctly diagnosed for the Lyme disease. First, it will present with flu-like symptoms such as fever, headache, chills, sweat, muscle aches, fatigue, nausea, joint pains, all those symptoms, I'm sure you can find them in other diseases. This is how Lyme disease presents. And then some patients may develop a rash, and other patients may develop Bell's palsy, that is facial drooping, like this guy you are seeing here. Although a rash shaped like a bull's eye is considered to be characteristic of Lyme disease, many people develop different types of rashes. We are going to see them in our next slide. So you can see the types of rashes that can develop. But the most characteristic one is the bull's eye. We can have different types of rashes as shown in those pictures. Testing and diagnosis. We can make a diagnosis based on symptoms: red expanding rash, fatigue, chills and fever, headache, muscle and joint aches, and also swollen lymph nodes. All those symptoms might help us come up with a diagnosis of Lyme disease. The most common types of tests for the Lyme disease are indirect. They measure the patient's antibody response to the infection and not the infection itself. And that's why we have said most of the patients will develop this disease, and they might even go undiagnosed. During the first 4 to 6 weeks, these tests are unreliable because the patients have not yet developed the antibody response the test measures. So which are these types of testing? We have one, ELISA test, enzyme-linked immunosorbent assay, most often used, and ELISA test detects antibodies to the bacterium. We have the Western blot test, and this one, it confirms ELISA test diagnosis. It is usually done to confirm the ELISA test diagnosis, and it is done in the two-step approach. Then we have PCR tests, polymerase chain reaction. PCR detects the bacterium DNA in fluid drawn from an infected joint. So you can do ELISA test, Western blot test, and the PCR test. Treatment. We have said that oral antibiotics are usually given during the early stages, the localized stage, and we use doxycycline or amoxicillin. We can also use cefuroxime. They are taken for 2 to 4 weeks. These are oral antibiotics. IV antibiotics are used for more serious cases, that is during the early disseminated stage. And if the disease involves the central nervous system and the brain, the doctor may recommend IV antibiotic treatment. And this is effective in eliminating the infection. Post-treatment Lyme disease. We have said in stage 3, that is where we have chronic persistent stage of the disease. It is not uncommon for patients to have lingering symptoms of the disease even after treatment. They may experience fatigue, pain, and joint and muscle aches even after they finish the treatment. These symptoms can last more than 6 months to years. This is sometimes called chronic Lyme disease or post-treatment Lyme disease syndrome. Medical experts believe it is as a result of residual damage to the tissues and the immune system that occurred during the infection. The education that we provide out there to prevent Lyme disease, number one, is to avoid tick habitat. Ticks tend to be near the ground, in leaf, litter, grasses, bushes, and fallen logs. Avoid tick habitat. Number two, dress defensively. What are we saying? Wear shoes, socks, long pants, long sleeves, tie back long hair, and wear a hat. That is defensive type of attire. So again, light-colored clothing. Light-colored clothing helps spot ticks before trouble is caused. Ticks are dark-colored with black legs. So if you wear light-colored clothing, it helps you to spot those ticks before they can bite and cause trouble. Then hot dryer. What does it mean? Running your clothes in hot dryer for 10 minutes prior to washing them will kill any ticks possibly left there. So hot drying is very, very good for 10 minutes before you wash them. The other thing is use of repellents. You can purchase clothing that can be pre-treated with permethrin, or you can purchase permethrin itself and spray on clothing yourself. For exposed skin, repellents with DEET, we have picaridin and lemon eucalyptus oil are most effective. You use repellents, and this one is to avoid these tick bites. Check for the ticks. You need to do a continuous inspection of your clothes and skin periodically for the ticks. Brush off those that are not attached and remove any that are attached to the skin. The other thing with patient education is to get enough rest and sleep, and we are saying adequate sleep can be incredibly beneficial for Lyme disease patients as it helps to directly combat and reduce inflammation. We are saying Lyme disease, as you can see from the rash, it is an inflammatory disease. So whatever promotes this inflammation, you need to avoid. Whatever helps with relieving the inflammation, that is what we adopt. So avoid caffeine and alcohol. Why? Lyme, we have said it is an inflammatory disease. The infection can cause inflammation throughout your body, which can manifest in different ways, including systemic hives. So certain foods, including alcohol and sugar, can trigger this inflammation and make you feel worse. So it's good to note that anything that can worsen the inflammation should be avoided. For the exercises, you need to perform moderate exercises. Remember, this is a patient who is suffering from pain in the joints, stiffness in the joints. Lyme patients are often plagued by fatigue and musculoskeletal pain. This can make exercise portion of a wellness routine difficult. However, the key is exercising in moderation. Exercise in moderation and finding an exercise routine that fits your life. The other thing, eat a high protein, low carbohydrate, and as we have seen, sugars can worsen the inflammation. So that's why we are saying low carbohydrate and low fat. Those worsen the inflammation. So we need to provide a diet that has low carbohydrate, low fat diet. So high protein, high fiber diet, that one is okay. But we need to go low on carbohydrates and fats. Let us now look at the tick removal. How do you do that? Use a fine point tweezer. Use fine point tweezers. Grasp the tick as close to the skin as possible. If you do not have tweezers, protect your fingers with a tissue or gloves to remove the tick. Pull the tick straight out with steady, even pressure. Disinfect the bite area. Wash your hands. Hygiene is very important, even for just the normal body hygiene is very important, because when these ticks stick to your body, we have said prompt removal of those ticks will prevent you from contracting this bacterium. And now it will require you to bathe, and while you are bathing early enough from outside environment, that will help you a lot. So personal hygiene is paramount. Wash your hands. Dispose the tick by submersing it in alcohol. Place it in a sealed bag or a container. Wrap it tightly in a tape and flush it down the toilet. From the picture there, you are seeing another method of how to remove a tick using a tick spoon remover. Tick spoon remover, you place the notch near the tick and then you slide forward. You place near the tick and then you slide forward. That's another way of removing the tick. We have the do's and don'ts. So we have covered the do's. Now what are the don'ts? What you are not supposed to do. 1, do not squeeze, twist, or squash it. Do not squeeze, twist, or squash it. Do not burn it. Do not cover it with Vaseline. Do not crush the tick with your finger. Avoid folktale remedies such as painting the tick with nail polish, or even petroleum jelly, or using heat to make the tick detach from the skin. You'll burn yourself. So remove the tick as quickly as possible. Remove the tick as promptly as possible. So we have come to the end of Lyme disease. It was a short topic. We have said that it is caused by bacteria called Borrelia burgdorferi. It is transmitted to humans through a bite of infected deer tick. So we have also learned the clinical manifestations of Lyme disease, how we test Lyme disease, and how to prevent, the education that you give out to the public to prevent this Lyme disease. So any questions that comes on NCLEX about Lyme disease, I'm sure now you can be able to answer confidently. So as a routine, we always give you a chance to test your knowledge and understanding of the topic. So here I have prepared for you 10 NCLEX style questions. Kindly look at the 10 questions. We have provided you with the answers and the rationale. So kindly take your time and go through the question and see how many you can get out of 10 questions. thank you so much for being with us throughout this session. It has been a pleasure to be with you. And for those of you who are visiting our channel for the first time, kindly subscribe to the channel. This will help you get videos that we upload frequently. As soon as we upload them on our YouTube channel, you'll be getting notification immediately. You'll be the first to get those notifications. So kindly subscribe, and also remember to share with other people who are preparing for the NCLEX exam. Let them also come and visit our channel and be able to benefit just like you. So let's see each other in our next video. Thank you.